Okay, I'll call to order the regularly scheduled meeting of the Community Corrections Partnership. I will take roll starting on my right, if you'll state your name and the agency you represent.
Corey Wu, Workforce Development Board, representing Chris Donnelly.
Pam Patterson, DA's Office, Victims Unit.
Robin McCrae, Community Human Services.
Bob Masterson, King City, representing Monterey Chiefs.
Sheriff Bernal, Sheriff's Office.
Marcia Parsons, Probation.
Annie Brereton, Deputy County Counsel.
Chris Rule, Superior Court.
Elliot Robinson, Social Services.
Susan Chapman, Public Defender.
Amy Miller, Behavioral Health.
Yvette Irving, Monterey County Office of Education.
Thank you. Do we have a quorum?
Let the record reflect that we do have a quorum of the CCP EC voting members.
Thank you. Are there any additions or corrections to the agenda?
Let the record reflect there were no additions or corrections to the agenda.
All right, and with that, I will take any public comment on any item not on the agenda. Is there any member of the public that would like to make a comment on any item not on the agenda? Seeing none, bring it back. We have some meeting minutes to approve on the consent calendar from our meeting very recently of February 12th. Are there any corrections or additions to the minutes? Seeing none, I'll entertain a motion to approve. Second?
Second.
All those in favor say aye. Aye. All those opposed? Abstain? Thank you. We have a couple of scheduled matters today. One is to approve a funding augmentation from the Sheriff's Office, supporting some victim impact programs through the Restorative Justice Partners. Are there any questions or comments from the partnership? Do you have somebody here who would like to give a presentation, Sheriff?
Yes, I believe Captain Bass.
Good afternoon, Madam Chair, CCP board members. Part of what we want to do, I sit on the Restorative Justice Committee with Madam Chair and a couple other members of CCP. It's been a goal for a number of years now to bring some sort of restorative justice programming into the jail. They've been in the state prisons, or at least the two local prisons, for a number of years. It's proven to be successful down there. And through Restorative Justice Partners, we're looking to bring the victim impact program into the jail so that we can provide additional programming for our inmate population to hopefully help them understand, you know, the outcomes or what the effects are of their crimes and things like that, and interacting with the victims and hopefully helping them to reintegrate back into the community. So the one-year pilot that we'd like to try with the Restorative Justice Program is what this would fund, the $44,133. And that would be to bring the victim impact program into the jail so that we can offer that to our inmate population.
Thank you, Captain. Are there any comments or questions?
Just a question. I mean, I know restorative justice, you know, the concept is very important. I'm just curious why this wasn't part of the original budget package, kind of separated by just a week plus. And I don't know if that's a question for probation or a question for the Sheriff's Office.
We were unable to get it together in time for us to bring it together for the regular budget package.
Okay.
Are there any other comments from the partnership? I would just say that as a director of our youth center camp for 3 years, the camp incarcerates young men for a year. I used to do exit interviews with them, asking them what programs they got the most out of at the youth center and what they felt was not so helpful. And the #1 program that they felt they got the most out of was the Victim Impact Program. So I'm really very happy that we're able to bring it into the jail.
Thank you. And recidivism have a real positive effect for our community. So I would encourage the other board members to seriously consider approving this project.
Thank you. Any other comments or questions? Is there any member of the public that would like to comment on this item? Seeing none, I'll bring it back for a motion. Thank you. Second?
Second.
Who second? Can somebody else?
I'll second.
Thank you. Any other further discussion or questions? Seeing none, all those in favor say aye. Aye. Opposed? Abstain?
Court abstains.
Thank you. And now, I think we will ask Under Sheriff Minot to do a presentation on jail-based competency treatment.
Thank you, Chair, and the rest of the partnership. John Mino, Under Sheriff. This is an information piece just to talk for a minute about jail-based competency treatment programs. As we all know, our jails throughout the state are dealing with an increasing number of mentally ill offenders. There is a drastic shortage of state hospital beds, and anytime an offender gets deemed incompetent to stand trial, it is a very long and very painful wait for them to get access to, whether it's Napa or Atascadero or wherever it is that we can get them seen. So over the past several years, it actually started back in 2010. The Department of State Hospitals partnered with the San Bernardino County Sheriff's Office and opened a jail-based competency treatment program, or JBCT. And that was very successful. They've since expanded their capacity there in San Bernardino. Since then, they opened one in partnership with the Sacramento County Sheriff's Office. Last year, in 2017, they opened another with Sonoma County Jail. And then just here recently, in January of 18, they opened another with the Stanislaus County Jail. Department of State Hospitals is still very interested in increasing their capacity. As we know, we have a number of folks in our jail here that they wait and they wait, and it's no good for the inmate because they're not getting the kind of treatment they need. They spend a long time waiting before they can get off to the state hospitals. So part of this idea here in Monterey County started a little over a year ago. We sent a contingent to the Stepping Up initiative in Sacramento to talk about how to better deal with mentally ill offenders, and there was a pretty wide contingent here. I was there, the chair, Manny Gonzalez, the DA's office. There was a fair number of us that went. We got approached by state hospitals because they're still talking about increasing capacity. So we've talked with them loosely throughout the year, and then we really didn't want to do anything until we had something settled with our inmate health care program, because we didn't know who was going to be here in providing the inmate health care services. That just got settled back in December, and so then we opened a more formal dialogue with the state hospitals. Manny Gonzalez, Susan Blitch from County Counsel's office, and I have talked to them a couple of times. They talked about their Sonoma program. Department of State Hospitals is very happy with the services that they're getting there from Sonoma County Jail. That was a 10-bed program. It's just getting ready to expand to a 12. And then Stanislaus is just brand new, so they don't have a track record yet. Long story short, when Department of State Hospitals sponsors a program, they will pick up all of the costs it takes for custody and for treatment. So they would pay us for the space, they would pay us for the treatment, and on a per bed per day basis, not a per head per day. So if they contract for 12 beds, they'll pay for 12 beds whether they're full or empty. Department of State Hospitals monitored the intakes for our area, and we don't have enough just with our county alone to support a 12-bed program, but they feel like if we partnered us, San Benito, and Santa Cruz, that we could support a 12-bed program that would take very good care of all three counties. So after a couple of conference calls, since the time we drafted this document, we've had another conference call with Department of State Hospitals just 2 days ago, and we're feeling more optimistic that we're going to be able to take this off to the Board of Supervisors and at least open up a dialogue there and see if they want us to move forward with negotiating a formal contract. Last week, I reached out to the public defender in Sonoma County, Kathleen Posey. It sounds like it's a small network. There's 58 of you, so it sounds like she's one of your counterparts. And she had nothing but good things to say about the program they have in Sonoma County. She said, by far, this is the best thing they've done for their 1370 offenders as long as she's been there. She said that they're getting people in what she described was right away now instead of them waiting a long time before they get off. And she said she's just been very happy with how this has gone. She said she gets very regular updates from the nursing staff and really feels like she has a lot better connection with what's going on, the treatment they're getting, and they're getting restored. And I've toured the Sacramento JBCT, and that was their perspective as well. They said, we're getting people in the program restored to competency and back and in court before we could have ever got them off to Napa. So it just feels like there's a ton of potential here. The state needs the beds. The state has, it sounds like they have money that they're willing to pony up. We won't know for sure until we actually enter formal negotiations. And if they're willing to pick up all of the costs to, we would certainly want to make some of the same, do the same suicide type mitigation work that we've done in other parts of the jail. If they're willing to pick up the tab to get that going and to pay all the treatment, pay all the custody, this just seems like a win at every turn. It's good for our inmates. It's good for us. We're housing these folks anyway. We're just housing them in jail, and unfortunately they spiral while they're waiting to get this treatment. So we wanted to bring it here because obviously this is the group that has a huge interest in what's happened in our local corrections system, just to talk about what we might, how we might be able to do this moving forward. So this has been a huge priority for the sheriff since he came into office, and certainly since over this past year, as we've seen more and more of these, since he sent me to Stepping Up last year and said, find a way to do something more for these folks. And so we think there's a ton of potential here, and we just wanted to daylight it for all the stakeholders and see if there was any questions or anything we could answer before we start moving this towards the board.
Sounds very interesting. I wish they had something for the juveniles because we experience the same issues with our incompetent juveniles. They languish in custody for quite a while prior to restoration.
So we talked with the Department of State Hospitals about that and asked if, so they've got a couple different providers throughout the state. So they're using Liberty down in San Bernardino. They're using, Sacramento County was already using UC Davis for all of their services, so they just expanded their contract. We wanted to find out if they had a preferred provider, so to speak, and the short answer is they don't. They do think there's some advantages if we can expand what we're doing already with CFMG, so we're talking about one pharmacy. We're not having to, manage two different sets of pharmacies through two different sets of doctors, and they feel like there's certainly some better chance for coordination of care, so we don't end up with any barriers between whoever is the primary mental health provider versus the medical health provider. They would, the short answer is they would, as long as we pick somebody that meets the qualifications that, that can provide the appropriate level of treatment staff, they provide the curriculum. DSH does, so they don't really have a dog in the fight. We did ask preliminarily CFMG if it was something they had an interest in doing and if they thought they could staff it, and the short answer was, yes to both. And then well, we're open to whoever could do it. I just, in listening to DSH, it does sound like there's some advantages to having one provider fits all. And I would say, if you have, when I talked to Kathleen up in Sonoma, she said, look, I was real sketchy about, she goes, I didn't know much about CFMG except by reputation, but I hadn't worked with them. And she said, look, I've got nothing but good things to say about them. And she said, if Sue has any questions or concerns, tell her to call me. She goes, because I was a skeptic going in, but I'm super happy with them. And it really, that would be the easiest way, because you're talking about a modification of a contract rather than trying to go back out and rebid just a JBCT piece. It would, not that it couldn't be done, it would just take a lot longer.
Yes.
Yeah, my only potential concern, because I've also heard really, really good things about CFMG, and other courts that have utilized that service for 1368s have been very, very happy. And it's just a concern about capacity, as they try and service more and more counties. I know in the court world, we often see difficulties finding psychiatric services for 1368. So that's the only concern I can think of.
Any other comments or questions for the undersheriff?
Just a comment. Anytime we can get services, programs, or any kind of treatment for inmates that just sit in jail for weeks or months on end, just waiting. I mean, anything we can do to serve them better is positive for the Monterey County Jail. So we're really hoping that this can move forward and we can get this going as soon as possible.
It's really good when it's free.
Yeah,
I
and
meant
based
to, I
on,
meant to say that.
and based on preliminary numbers, if they were willing to give us what they gave Sonoma, which I can't imagine they wouldn't, then this is easily cost neutral at the worst case scenario.
Madam Chair, I have a quick question for Amy. If she has any experience with these programs in other counties, I mean, you also have counterparts in the counties that have this program, and I don't know if you can reach out to them and find out what their, experience has been. I think would be helpful.
Yeah, and I have reached out and I just haven't heard back yet.
Any other comments from the partnership? Questions? Any member of the public?
Oh,
Yes.
I was just going to say, just conceptually, it seems like it's a good idea.
It certainly does. Any member of the public like to comment on this item? Seeing none, bring it back. Thank you very much. Thank you for your presentation. And I'll take announcements, starting at my left. Yvette?
Nothing, thank you.
Nothing to report.
Corey?
I am putting together the largest community job fair. It'll be in the peninsula on April 25th. We encourage everybody to attend. Everybody's welcome. We normally get about 1,000 job seekers coming through, and I anticipate to have over 100 employers come in. So it'll be April 25th, and it's not released yet officially, but I'm letting you guys know. I'm on the committee, so that's exciting.
Thank you. Well, this was a short one, so thank you, and we'll see you in May. This meeting is adjourned. Thank you.